Hi everyone, it's Dr. Ann Cartini. I hope you all had a wonderful Christmas. This year it was just my husband and me. We didn't have to travel anywhere, which was completely okay with us because it was a nice and quiet Christmas. I know it's been a while since I've been on YouTube, but I will be better about posting videos. So thank you so much for subscribing to my channel and for watching my previous videos. Today's topic is something that I've been embarrassed about for a really long time, but if it means it's going to help other people who struggle with this same issue, then it's completely worth it for me. So today's topic is on endometriosis and uterine fibroids. I had been diagnosed not too long ago. I knew I had these symptoms for quite some time. Starting in my early 20s, I had very, very heavy menstruations to the point where big clots would come out. I know it's a little maybe TMI, but again, I want to be as candid as possible and help anyone who might be struggling with this. So just to go back in sharing with you the history of my health history, in case you haven't seen my previous videos, growing up, I had not had the best diet. I would say my diet consisted of heavy dairy foods, as well as processed breads, sugars, cereals, processed meats. It was something that we didn't really think about growing up. I grew up in North Dakota, so cheese and beef were very prevalent out there, and I rarely ate vegetables and fruit. Due to the diet that I was on, I had developed high cholesterol, prediabetes, stage 1 hypertension, eczema, plaque psoriasis, irritable bowel syndrome, and I do believe that endometriosis and uterine fibroid was also a result of my poor diet in the past. The good news is now that I have been on a whole food plant-based for a couple years now, I have seen a reversal in the cholesterol, the diabetes. I'm no more pre-diabetic. Hypertension, my blood pressure is completely normal. Eczema is completely gone now. Oh, and then also irritable bowel syndrome. It after, I would say, a month or so of eating a truly whole food plant-based diet, for someone who's struggled with irritable bowel syndrome for decades, for it to go away in a matter of a month, in my case, is amazing. And so I am such a true believer in how foods can be medicine if you eat the right foods. Now, in terms of my plaque psoriasis, I have seen a reduction. It hasn't completely gone away yet. It is considered an autoimmune disease, and so I noticed that things such as stress does cause it to flare up some. I haven't taken out gluten from my diet, and so I don't know if that might be a factor. But because of my diet thus far, I have seen a reduction. So I am very, very hopeful. With my endometriosis and uterine fibroid, there are studies that show that there is a link between diet as well as a reduction in the lesion of endometriosis, and I'll go over that more in a little bit. So endometriosis is quite common in the ages of 18 to 35. 1 in 10 women are affected during their reproductive years, which is the ages between 15 to 49. It can happen anywhere between 20 to 50% in women who are fertile, and for women who have a chronic pelvic pain, we actually see that 71 up to 87% of these women have endometriosis. And so it's a lot more common than we think. Oftentimes it doesn't get properly diagnosed because it's not that easy to diagnose. A family history has shown to be a link, whether or not you have it, but I think a lot of that also has to do with when you're in the same household, you tend to eat the same foods, you might have the same stressors when it comes to environmental factors. Again, going back to what is endometriosis, it's considered a chronic condition. The lesion is there. It might flare up depending on what hormones are in your body, such as when you're on your menstruation, if you have a higher amount of progesterone, that could cause more inflammation and pain during that moment. And then for diagnosis, it often requires lab testing or imaging to see if they can see any lesions. The endometriosis it's often seen as a reproductive disease because it often impacts the ovaries, the fallopian tubes, but it also can be found on the bowels, bladder, appendix, and other organs. And in rare cases, the disease can be found in the lungs, which is kind of scary. Yikes. How serious is it? Well, if left untreated, depending on the amount of the endometriosis, the endometrial tissue and where it is located, symptoms can be debilitating, such as in my case. It can affect fertility, and because it is something inflammatory later on, it can develop into uterine or ovarian cancer. It makes sense because cancer starts out with inflammation, and endometriosis is inflammatory tissue. So some of the causes of endometriosis, right now, there's not really a clear, cause of why it does happen. But we've seen in studies that hormonal imbalances can contribute to endometriosis, surgical scars from surgeries such as a C-section or hysterectomy. We've seen cases where immune system, where it is compromised, this endometriosis can occur. Genetics has a factor. I really also believe diet is a huge factor. With someone who's had so many inflammatory diseases, like I've mentioned earlier, eczema, plaque psoriasis, irritable bowel syndrome, these were so severe and debilitating, and it's not a surprise to me that during my menstruations I had such immense pain and heavy bleeding. And once I had gone on the whole food plant-based diet, most of my diseases have completely gone away. The psoriasis has reduced significantly, but so I really do believe diet has a key. How do we prevent endometriosis? We've seen birth control can control our hormones, since it can be a hormonal issue. So with hormones, you kind of control that. Exercising regularly helps. Reduction of junk foods, which makes sense because junk food is very inflammatory for our bodies. And if you reduce alcohol and caffeine, that helps. The next lesion, which is the uterine fibroid. Here's a picture of where fibroids can occur in the uterus. It's basically a benign tumor that consists of muscular or fibrous tissue, typically developing in the uterus. It is also quite common. How I was diagnosed is, like I said, in my 20s, I noticed heavy bleeding, heavy clotting, big clots that occurred for an extended period of time. I would say 10, sometimes 14 days of bleeding. And that was in my 20s, but it wasn't officially diagnosed until a couple years ago when I did the imaging with my gynecologist, when she did the ultrasound and checked for lesions in my uterus. She found a golf-sized fibroid towards the posterior part of my uterus, kind of almost where, towards my back, which makes sense because I do get back pain when I am on my menstruation. She also found casings, which I saw, she pointed out to me in the ultrasound, when she was doing the imaging. I saw these casings around the ovaries, and we did the imaging 2 times just to make sure it wasn't, I guess a false positive, where, I don't know if, well, false positive is the correct word, but she wanted for me to come back 3 months later, right after I finished my period, to make sure it wasn't an ovulation episode in my ovary. And so anyway, in summary, when I came back, the ovaries looked the same. And so she really believes that I had not only the uterine fibroid, which was very clear in the imaging, but she believes that I have endometriosis in both my ovaries. So it makes sense. I'm not surprised because of the multiple inflammatory diseases that I had struggled with growing up. I know that with being on this diet, things have gotten better over time, which is great. I do believe I got it from eating poorly. How are ways endometriosis can be managed? Well, pain meds can manage it. It's not my favorite. Sometimes the pain from, I'm sure it's from both the fibroid and the endometriosis, sometimes it's so debilitating that I do have to take ibuprofen and Tylenol just so that I can concentrate at work. There's also hormone therapy. Some people take that in the form of like birth control pills, but you know, obviously if you're trying to get pregnant, you don't want to be on that hormone therapy. There's actually a study that I came across that was published in the Journal of Endometriosis and Pelvic Pain Disorder. They looked at the relation between diet and inflammation in endometriosis. So in summary, which is not a surprise, that it showed that there are components in food that can indeed reduce the inflammation and pain in patients with endometriosis, which is awesome and very encouraging. So it does make sense, you know, with the foods that I've eaten in the past, and now seeing reversing a lot of that today. It hasn't been that long, but I'm positive or hopeful that my endometriosis symptoms can get better. So how do I personally manage it? Well, I'm going to continue with my whole food plant-based diet because unfortunately, even in surgical procedures where these tissues, these lesions are removed, they can come back, because if you're constantly incorporating inflammatory factors into your body, it's going to come back. And so I just want to make sure I maintain a healthy, clean lifestyle and manage the endometriosis tissue and hopefully reduce the pain and inflammation with diet. However, at this point, with the uterine fibroid that's in my body, although there is evidence that fibroids can shrink to an extent, in my case, I don't believe that I would be able to get rid of it completely because it's a fibrous tissue. It's hard tissue. And because my menstruations are so heavy, I really would love to address it. In this case, with a minimally invasive procedure. And so I had been doing a lot of research on what my options are to address the fibroid. Again, with the endometriosis, I will try to manage that and hopefully decrease its size with diet and not have it come back. If anything, we don't want it to progress in size nor become cancerous in the future. So far I've researched different procedures. There are so many options out there, but I focused on ones that were the least invasive, as well as did not affect fertility too much, which means procedures such as hysterectomy, where the uterus is completely taken out, that's out of the question, and also ablation, where the inside lining of the uterus is destroyed. Both those procedures can address fibroids and pain and menstruation, but in my book, I did not want to go that route. And so these are just some that I wanted to share with you that I found could be options. So for non-invasive, of course, diet, which I will continue to incorporate in my lifestyle. So another option is hormone therapy. However, in this option, they oftentimes mimic menopause, and so that kind of reduces the chances of fertility or having a baby. So, and also I wanted something that really didn't want to feel like I'm putting, hormones that aren't mine in the body. So anyway, and there's also this new technology called focused ultrasound surgery. It's newly FDA approved, and although it says surgery, it's actually minimally invasive, and it's actually not a surgery where they cut you open. So far, although it's new, data has shown that it's pretty safe and effective, and I'll go over that procedure more in just a little bit. Some other minimally invasive procedures I've come across and read about were uterine artery embolism, where small particles are injected into blood vessels that feed the uterus at the location of the fibroid. And so the goal is to plug up those little blood vessels to help the blood supply to the fibroid so that it shrinks and eventually kills the fibroid. Now, while it's minimally invasive, the problem with that is that if there are it can go into blood vessels that feed into ovaries or other organs, and so you could have complications with fertility and other more serious things. And so I was a little nervous about that route, but not bad. But again, like I said, fertility, it can reduce fertility if it kills off, a part of your uterus or your ovaries. That would affect your chances of getting pregnant. Another procedure is laparoscopic or robotic myomectomy, which is where small incisions are made, and there's a small camera on one instrument, and on the other slender instrument, the fibroid can be removed successfully. The lesion is magnified, and the surgeon can see it in 3D. And so this option seems to allow much precision than some of the other procedures that I've read about. So going back to focused ultrasound surgery, this option intrigued me the most. While it is the newest procedure that I've researched out of all of these, it just seems very promising from what I've seen in the data so far. Focused ultrasound surgery is also known as magnetic resonance guided focused ultrasound surgery, which again is a non-invasive treatment option. This treatment happens when you're in an MRI scanner equipped with a high energy ultrasound transducer. And so the MRI scans show the precise location of the fibroid so that the other tissues and organs can be avoided, such as you don't want your bladder or your bowel to be damaged in the process. And so while your other tissues are being monitored, there's an ultrasound transducer that delivers sound waves into the fibroid to heat and eventually destroy the tissue of the fibroid. So I thought that treatment is very interesting, and I will let you know the information that I've received. Whatever procedure, if I do decide to proceed with it, I will of course show you that journey just so that you guys can see what it's about. Now, if any of you have already gone through a procedure that addressed your endometriosis or uterine fibroid or both, I would love to hear your experience because I really do believe it's helpful in just talking about it and learning from each other, because it can be daunting. And again, for so many years, this is something that I had been very hush-hush about. It was something I was very embarrassed about, but it's so common. Many women struggle with it. So if we can get the word out and help each other, it's a win-win situation. We are not alone in this. Thank you so much, everyone, for watching my video. Feel free to click on the like button if you found that this video was helpful, and subscribe to my channel if you'd like to see more videos just like this. I'd love to stay connected with all of you on Instagram. I have 2 Instagram pages, which I will put the links down below. And please feel free to shout out and say hello or let me know what your experience has been. I'd love to learn from you all. Again, thank you so much for watching this video and have a wonderful day, everyone. Bye.